Positioning Project, PA Mandible. For patient preparation, I met the patient, introduced myself, and verified with him the body of interest we were imaging that day. I then had him tell me his name and date of birth so I could verify that his information matched on his chart and wristband. When patient verification was completed, I donned the lead shielding around the patient's waist and proceeded to instruct him to sit on the stool that was placed in front of the wall bucky. I held the stool with my foot when he sat down so it could not roll away or cause him to fall. IR size. For this imaging series, I chose to use the 10-inch by 12-inch, 24 by 30 centimeter cassette, IR orientation and location. For this image, I used the wall bucky and I placed the cassette inside in the portrait orientation. SID. I set the SID at 40 inches, 100 centimeters. The patient position. The patient is seated on a stool facing the wall bucky. Part position. The patient is facing the wall bucky with his forehead and nose against the bucky. His chin is raised to bring the AML perpendicular to the IR. MSP is perpendicular to the midline of the bucky, ensuring no rotation or tilt of the head. CR location. The CR is the line perpendicular to the IR, centered to exit at the junction of the lips. CR angulation. The CR is perpendicular to the IR. Collimated field size. Collimation from left to right is 1 inch, about 2.54 centimeters, on either side of the widest part of the mandible. Top to bottom collimation is 1 inch inferior to the mandible and 1 inch superior to the condyles, making sure to not cut off any anatomy of interest. Visual appropriation of the marker. The marker is in the bottom left corner of the image to be seen in the image, but not to impede on any anatomy of interest. KVP range for this patient was 75 to 90 KVP. Instructions to the patient. As I took this image, I instructed the patient to not move, to hold his breath. I took the image and then told him to breathe and relax. Anatomy demonstrated. The PA mandibular rami and lateral portion of the body are visible. Pathology items in profile. Nothing is in profile. Pathology best demonstrated or clinical indications. For this image, clinical indications and pathology shows fractures, neoplasticism, or inflammatory processes of the mandible.